everyone. I'm excited to be on here today. I am toasty warm. I just did a podcast and all during the winter time, it was hot out here in my cottage. Excuse me, it was cold out here in my cottage. I had a heater blowing on me all the time, and now it's hot. So I got to figure this out. I've got a door open, but if I get red cheeks, you know why? Because it's getting toasty. But I love the heat. I love summertime, so I'm not going to complain about it. All right. I thought I'd start off by talking a little bit about fluoride today. As I was talking about this on the podcast today, I thought, you know what? I need to definitely sorry, I'm going to turn that off. Do not disturb. I need to talk a little more about fluoride when I'm on these lives. So let's do that just for a minute. And about the tooth powder, why I formulated it the way I did, the reason that it has the ingredients that it has. So let's talk just a bit about that. First of all, fluoride was started for a good reason. They found out that people that had more natural fluoride in their water, they had well water, those kinds of things, that they actually had stronger teeth. So they identified what was in the water that was different, and they found out it was fluoride. Well, fluoride does make stronger teeth. It makes the enamel crystal out here turns into something called fluorapatite instead of hydroxyapatite. And fluorapatite is harder and more brittle. The trouble is, so that's not really the problem, although you can overdose and get blotchy, white and brown blotchy teeth that are really not very good to look at. But that's not even the main issue. The main issue is that fluoride doesn't just change teeth. So there's also hydroxyapatite in bones. So it changes the hydroxyapatite in the bones and turns it into fluorapatite as well. Again, stronger but more brittle. Is a brittle bone a problem? Of course it's a problem. And there's research showing that in highly fluoridated areas, there are higher incidences of hip fractures and things like that. But that's just the starting point. So it does affect bones. It also affects your thyroid. The thyroid hormone is activated by iodine. Well, fluoride looks just like iodine. And so it will push iodine out and it will actually bind the thyroid hormone, but it will make it so it does not activate. It doesn't work in your body. So now we have all these people who have hypothyroid issues. Why? Fluoride could be a part of this. Now there's research showing that fluoride doesn't just affect the bones and the thyroid, it also affects the brain. So research shows that in areas that have high levels of fluoride, kids actually have lower IQ scores. I know this is kind of one of those statistics that people roll their eyes at and go, oh, whatever. No, go look it up. It's on PubMed. It's a research study showing lower IQ scores in areas that have higher fluoride. And literally May 24th, just 2 weeks ago, there was another research study that showed that children whose moms were exposed to fluoride during pregnancy, these children had a higher incidence of neurodevelopmental issues. What are those issues? Autism, for one. So fluoride has now been implicated in all sorts of brain problems with kiddos and adults alike. Is it worth it? Heavens no, because we have an alternative. Cavities are not a deficiency of fluoride. They're not. They're a deficiency of minerals. And what is the mineral? Hydroxyapatite. So that's why I formulated the tooth powder, because instead of treating a cavity with something it never had and affecting the body head to toe negatively, let's just treat it with what it already has, which is hydroxyapatite. So if this affects the bone, great. It's going to give you stronger bones. It's going to, and it dissolves in the stomach. So it just dissolves in the stomach and turns into minerals that your body needs head to toe also. So this is awesome. Tooth powder. The reason I made it into a powder to begin with is because I didn't want to put anything in here that wasn't actually treating the tooth. So the hydroxyapatite gives minerals. The bentonite clay gives minerals. The calcium carbonate gives minerals. The xylitol kills bacteria or makes it so bacteria can't thrive in your mouth. The essential oils all have medicinal effects as well. They're anti-inflammatory. They're antimicrobial. Everything in here does something for a reason. Nothing's in here just because the paste or the powder or the formula needed it. That's what I wanted to stick with. So somebody just asked, how's the toothpaste coming along? It's coming. Actually, the formula is amazing. It's with a manufacturer right now. And interestingly enough, instead of using xanthan gum or sorbitol or glycerin or any of the other things that are in the pastes to make them a paste, I've actually used something else. Cucumber extract. Cucumber extract is the binder so that nothing in there is something that your teeth don't actually need. What's the timeline? That's a great question. The manufacturer is working on getting it tubed and back to me to make sure that the samples aren't going to dry out. So that's the problem. Glycerin and sorbitol, they keep the toothpaste pasty and not drying out. Well, my binder is water. it evaporates. So we're finding out, making sure that it's not going to dry out inside of your tube, because you would not like that if that were the case. So we're testing some things out. We're still in the testing phase. We really hope by the fall you're going to be able to see it. But for now, grab the tooth powder. I promise you'll get used to it. So many people say, I couldn't get used to it at first, but then I did, and now I can't live without it. I promise you'll love it. Toothpaste coming soon. All right, so let's talk about what does it mean when my hyoid bone is high on my CBT scan? Well, that's an interesting question, very technical question. What does that mean? Hyoid bone is right here. When it's high on a scan, what that means is that your tongue, it's also connected to the back of the tongue. So if your tongue has to pull forward all the time to get up and out of the airway to allow more air to pass, the hyoid bone will be raised up. So if you see a high hyoid bone on the cone beam CT scan, it means that you are working hard to get enough air. Your tongue is pulling forward. So you need to look at probably expanding your mouth and making more room for your tongue in the mouth. We already said that. I heard this morning on the news that xylitol can cause a stroke. What is your take on this? Absolutely, if you drink or eat a whole bunch of it. So they've done studies with this where they feed rats, like literally a whole, pounds of xylitol, and it'll cause a stroke. Well, I guarantee if you feed them anything in that amount, it's going to cause a stroke. So absolutely, it will do that in high quantities. That's why ours are very, very minimal, very small. And also why in the toothpaste, I'm actually not using xylitol. Toothpaste is going to be sweetened with stevia only. So, most people don't like an unsweetened version of some sort of toothpaste, tooth powder. That's why we use xylitol. Xylitol is actually excellent for decreasing cavities. Excellent. All on its own. It decreases bacterial growth, which decreases cavities. So it's awesome. But we don't want to deal with any of these issues or any of these thoughts. Again, it's such a minuscule amount in the tooth powder. It's not going to cause any of these issues. If you go look at those studies, what you're going to find is it's all done with massive amounts. If you're using, cups of this to bake cookies with, well, we're not doing that. We're using a teeny tiny bit to just flavor. But again, in the toothpaste, we're not even going to use xylitol. But xylitol is actually great for cavities, for preventing cavities. What sleep study do I recommend? Well, so the one that we like to use is called Sleep Ring. Is that what it's called? Sleep Image. Sleep Image. And it's a ring that just goes on your finger and you wear it. Oh, sorry. I'm going to get off of that. There we go. Sleep Image. It's a ring that you wear. There's a few different kinds. The convenience of the ring is that you can sleep well. So sometimes when we're hooked up to a bunch of things, you actually don't really sleep true to what you typically do. So I like the ring because it's just really easy, or a strap around the chest because it's really, really easy. So those are the ones that we recommend. Any good oral probiotics that I recommend. So it's interesting because that's the other secret ingredient in the toothpaste is we have what's called an optibiotic. So not only is it a probiotic, but it's also feeding the good bacteria. So it's good bacteria, plus it's feeding the good bacteria. It's keeping everything healthy that we want to have healthy, but it's killing the bad ones. So it's like all of these things all wrapped up in one. So what I'm really hopeful for is that we don't have to use a separate product. We don't have to use a separate oral probiotic. Honestly, what I recommend at the moment is just the mouthwash because it has colloidal silver in it, which is going to kill bugs that you don't want. If you kill bugs that you don't want, the good bugs flourish and you really don't need to add other bugs into it. So for now, use the mouthwash, but soon the toothpaste will have an optibiotic in it. How many times a week can you use your whitening? So the whitening tooth powder can be used daily. There's no issue with doing that at all. So whitening tooth powder can be used daily, twice a day. No problems whatsoever with doing it that way. If you're talking about actual dental strength, peroxide-based whitening, typically it's for about 3 or 4 days is all you want to use that for. But the whitening tooth powder, as often as you want. I've got a chipped wisdom tooth, no pain, but it's graying. Should I let them extract and stitch it closed? If it's a wisdom tooth, typically, you have a choice. If it's graying, then most likely that tooth is dying. So that tooth needs to come out. So yes, graying tooth usually means dying. Let's remove it, especially if it's wisdom tooth. Make sure when they do that, they remove the ligament and that they place stem cells. It's called PRF, if possible. That's ideal. Vitamin K to take, MK4 or MK7. Which version of vitamin K? Well, first of all, you need to make sure it's vitamin K2. And then vitamin K2 comes in two forms, an MK4 and an MK7. These are based on which way they're derived. So where that vitamin K2 comes from, I usually like a combination of the two. So that's what we usually use. And our supplements is a combination of MK4 and MK7. Should the wisdom tooth be pulled if there's a cavity in between it and the molar? So again, another wisdom tooth question. It's an option. You can just fill the cavity. However, it's going to be more difficult to clean the tooth in front of the wisdom tooth if the wisdom tooth is there. So if it's compromising the health of the tooth in front of it, let's take the wisdom tooth out. I actually just told a patient that yesterday. It's compromising the health of the tooth in front of it. There's a deep gum pocket. You may end up losing that tooth, which would make no sense. Let's take out the wisdom tooth so that you can keep the tooth in front. So that may be your situation too. Can I actually see you at your office? I have all left side head, ear, jaw issues and constant dizziness for 12 years. Wow. Yes, you absolutely can see us at our office. So you can see me. You can see my other doctors. We have a team of doctors that all see new patients. So just give the office a call. It's called Total Care Dental. And phone number is 801-756-3737. But obviously you can go online, totalcaredental.com. and come and visit us. This is exactly what I do every single day when I'm there seeing new patients. I see people just like you, people who have dizziness and jaw issues and head and ear issues. And we have answers. We have answers. I just saw a woman yesterday, actually. She had had an accident. I'm trying to remember. I think she was about 17, if I'm remembering right, when she had this accident. She hit in a car, hit the dashboard, and it knocked one of her teeth out. So she lost one of these bottom teeth, and she had a root canal on another one and a bridge across here. And she'd had that. She was, if I'm remembering right, she was at least the late 40s, if not early 50s or so. And the reason she was coming in, however, wasn't this bridge or the root canal down here. It was actually her jaw. And when we looked at her jaw, what I found is that most likely when that accident happened, it probably hit on the right side of her chin right here and pushed the ball of the socket, ball of this jaw socket basically, or the ball of the jaw joint pushed it up against the socket. And when it does that, there's a piece of cartilage that sits on the top of the ball in this joint. Excuse me. And that piece of cartilage is hooked on the back by a ligament. Well, if the ball forcefully is pushed up, sometimes it will sever that ligament that's holding the piece of cartilage in place. So the cartilage actually slips forward and out of the joint. So it's just like if you have a knee that doesn't have cartilage anymore, same thing happens here. If the cartilage isn't between the ball and the socket, then you don't have any protection anymore. So as you open and close, which everybody does every single time we say a word or swallow or chew, the ball comes forward and out. If it doesn't have that protective piece of cartilage to come forward and out with it, then the ball is just rubbing against the bone of the socket. So you get bone on bone. And we know what happens if you get bone on bone in your hip or your knee or your shoulder. It gets bone degeneration. Well, that's what had happened to her over these many years, is she'd had bone on bone like this, rubbing it down. And so the ball, which was once a ball, was now kind of a hook like this. And it was very flattened off, and the socket was very flattened, and everything was functioning like this. So when we looked at her face, it was crazy. We looked at a picture, and even just looking at her, everything was shifted. Everything was shifted. So the left side of her smile was up higher, the left jaw was up higher, and everything was up higher on this left side because she had collapse in this jaw joint area. And just looking at her, we could see it. But then people don't often realize this. The way the jaw sits positions a little bit at the head. Everything in the body likes to be level. The body loves to be level. It likes to have our eyes level. It likes to have everything level. Well, because she's having these jaw issues off to this left side, then she had to position her head a little differently to accommodate for those jaw issues. Well, positioning the head a little differently is going to make it so that now the shoulder has to position a little differently to outweigh the weight of that head. When the shoulder position is a little different, then the hip position needs to be a little different to outweigh the shift in the shoulder. When the hip position is off, that alters the knee position, which alters the ankle position. We literally could look at her picture and we could just see this Z all the way around, all the way down from head and jaw to shoulder to hip to knee to ankle. Everything had been altered. She was having to stand slightly forward. She didn't even know it. She didn't even know it until we looked at her pictures and pointed out, went, look at your feet. Your right foot's slightly forward or the left. Why are you doing that? Well, I don't know. I didn't even know I was doing that. You're doing that because you have to balance, you have to counterbalance the shift. So the jaw affects everything downstream. So now that she has this degeneration in this one joint and literally everything, her face, her lips, everything is altered because of it. How do you heal it? What do we do about this? This is really fascinating. The key concept is the space. As long as there is space between the ball and the socket, the body will actually recreate scar tissue in the area. It'll recreate scar tissue and form a scar tissue bridge or protection when that ball opens and closes again. But the space is the key. So we actually create an appliance that keeps the mouth slightly open all the time. You bite against it, you chew with it, you talk with it, you do everything with it. But as long as it's in, it's allowing space for scar tissue to form. And we actually literally heal the joint so that it can be protected moving forward. And then we counterbalance everything. So we have to fix teeth, we have to fix spine, we have to fix everything, just aligns. And all of a sudden, no degeneration anywhere. So crazy cool what we can do with jaw joints that have been degenerated, no surgery needed, all these kinds of things. This is what I do daily. All right. If a tooth has an infection, does it really need antibiotics, or can ozone and PRF be enough? If a tooth has an infection, let's talk about which kind of infection. First of all, if it's gum infection, so that means it's just infection around the tooth. The key is you need to get off whatever has infected that area. So it might be tartar, something like that under the gum. And then you don't have to use antibiotics. We use ozone all the time in those areas. If the tooth is infected, meaning the tooth itself is dead. If the tooth is dead, you can't just take an antibiotic and have that go away. You have to actually remove the tooth. This is where you have the two options, right? We fork in the road, either a root canal or remove the tooth. You need to remove the tooth and clean it all out with ozone and PRF and everything else. So this question may be, do you have to take antibiotics at that time, at that removal appointment? And what we say is yes, in some form. So what we do is we actually offer it through an IV as well. And when you do it through the IV, you bypass the gut largely. There's still a few blood vessels that take it through there, but you largely bypass the gut and you don't have those problems that you have with taking an oral antibiotic. So we do it through the IV. We like you to have 3 or 4 even treatments with that. It's going to get to the tooth. It's going to bypass the gut largely, and it's going to take care of any infection that may still be residual down on the jawbone. I just had 4 dental cavitations removed, but currently I have 1 dry socket. What should be done to prevent cavitation relapse in a dry socket? Yeah, we don't love dry sockets in those cavitation areas. Basically, what a cavitation area is where a wisdom tooth was removed. Didn't heal right the first time around. We wanted to heal right the second time. So if that's the case, you need to go back to whomever did the surgery and say this isn't healing right, and have them do more ozone and more PRF so that it will actually heal the bone this time around. Any other advice to go with the tooth powder to help my 5-year-old who has so many cavities? Yes. So interestingly enough, with kiddos, some of the problem with cavities is gut function. And you don't think about this with kids. You don't think about them not having good digestion. So do the baking soda test. 5-year-old is old enough to do this. Baking soda test, you can just do half the amount of baking soda and half the water, have them drink it, see if he burps. If, actually he or she, I don't know, 5-year-old, see if they burp. If they burp, then burp within 2 to 3 minutes, then you know it's not a gut function issue. But if they don't, then you know it is a gut function issue. So you need to start adding some good probiotics. So go check out my Gut Health, Gut Rebuild. But I love Gut Well powder for kiddos because you can make a shake out of it. It tastes delicious. Everybody loves it. So you make a shake out of the Gut Well and have the kids drink it every single day. It builds the gut lining. It tastes delicious. So nobody minds doing it. And it's just going to help with that digestive function. So that's second thing is you need to make sure the gut's functioning properly. And then third, you really need to almost OD on minerals and vitamin D and K. So get the liquid vitamin D and K that I have on the site. That's awesome for kiddos because it has no flavor. You just put it in whatever. Liquid D and K that helps them absorb minerals better. And then you add minerals. And one of my favorite ones is from a company called Mother Earth Labs. And it's a product called humic and fulvic acid. It's such a weird name. I really wish they wouldn't call it this, but that's what it's called. It's basically dirt water. So you can use any form of liquid mineral along with that vitamin D3, K2, and that's going to help to rebuild and strengthen teeth. So you're going to do multiple things, minerals from the outside, minerals and vitamins from the inside, check the gut, make sure they're getting minerals and vitamins from the diet. Then just make sure the teeth stay really, really clean. That's a key as well. Make sure they're not mouth breathing. Mouth breathing will often lead to decay as well. Watch them at night. If their mouth's hanging open, time to talk to toothpillow.com. Time to get that mouth expanded so they can close the mouth, breathe through the nose better, all sorts of developmental things there. How much is it for a consultation? So we only do new patient visits in our office. We don't do consultations, meaning when you come in, it's going to be a full exam. We're going to do a full CBCT scan or cone beam CT scan. We're going to do a full workup of everything. Why? because I was doing consultations at one time. And what I found is when patients would come back after them, I had missed a whole bunch, not intentionally, but because I hadn't seen them. I hadn't looked in their mouth. I didn't know, oh gosh, we can't do that with that front tooth. It has a big cavity on it. I didn't even know because I couldn't see it on the cone beam CT scan. So we do a full workup. I believe it's around $500. Don't quote me. It's going to be somewhere in that vicinity. But that's what we do for all new patients now. My son has enlarged tonsils. What is your take on getting them removed? So the answer that I always give is, what's enlarging them? Why are they enlarged? Let's figure this out first. So we have to look at, okay, is there some sort of a dietary issue or an environmental allergy or something going on? I love something called NAET, N-A-E-T. It's often done by a chiropractor. They can identify what is desensitizing or sensitizing the body. What is the body sensitive to? Not necessarily always an allergy, but what is it sensitive to that's inflaming it? Let's figure this out first. Second thing is your son mouth breathing? If they're mouth breathing, that hot, dry air, unfiltered air is hitting the tonsils and they're inflaming, they're swelling to protect the body from all the things coming in from the air. So if your son is mouth breathing, toothpillow.com or come see us, either one, get that mouth wider so they don't have to mouth breathe. That's the next thing. Third thing is I don't like to remove tonsils because it is the lymphatic system of the head and neck, basically the garbage disposal of the head and neck. If you take them out, then what happens? Then the body's a little more unprotected. So find out what's inflaming them. Is it mouth breathing? Is it an allergy issue? What's doing it? We also do what's called tonsillays in our office, where if somebody can hold the mouth open for 15 minutes, we can shrink those babies right up. So there's a lot of things to do before removal. If it's last case scenario, you have to have removal, do that. But I would absolutely go to toothpillow.com first. I would check out allergies first. I would do everything first before you went there. What was the name of the cherry masher pitter you showed recently? I just bought a pound of organic cherries. So yes, everybody hates that cherry video that has worms in it. And those are just off of my tree. Maybe the organic tree that you had did some sort of organic version of pesticide, but I don't do any spray at all. I don't remember the brand, but it's on Amazon. Just look it on Amazon, and the cherries just roll down the little ramp, and you just choop, and it spits the pit out one side, and it spits the cherry out the other side. It's super slick, super fast. I've got 3 of them because we got a whole big tree of cherries that we go through, and then we freeze them all and use them in smoothies all year long. So just check it out on Amazon. You'll find it. It's just one that has a little plunger and plunges and pushes the pit out and cherry out the other side. My son, 13, was told he needs a root canal. The endodontist that was recommended uses the gentle wave procedure. What are your thoughts on this? All right, so a 13-year-old, we're in that gray zone here. Gentle wave is the best version of root canal filling material that there is. Does it completely clean the tooth? Not from research yet. Hasn't shown that it completely cleans it. Still issues with it being a dead tooth and dead tissue anyway, so I don't think I'm ever going to be on board with the root canal, but in a 13-year-old, I am, for a reason. Because on a 13-year-old, this happened to my 10-year-old son. He broke out a whole bunch of front teeth, did a root canal. Why? He needed some teeth for a little while. And on a 13-year-old, he needs to be able to hold that space. And he's not going to be able to get an implant until he's about 21 years old. So he needs this tooth for another 8 years or so. So what's going to happen is you're going to do a root canal on that tooth, and you're going to watch it very, very closely. You're going to make sure that you're watching x-rays, making sure it's staying healthy, and you're going to watch symptoms. So what are you going to look for? Depends on the tooth. So if it's a back tooth, you're going to look for gut issues. If it's a front tooth, you're going to look for liver or urinary issues. That's what you're really going to pay attention to. Back teeth, sometimes lungs, see if he has a struggle with breathing or running or asthma, anything like that showing up, then you know that tooth is reinfected. So watch it really closely. And then once he's old enough for an implant, again, take a cone beam CT scan at that time, see if it's healthy. If it is, maybe he can, limp along with it a few more years. My son's didn't last that long. It lasted till he was about 21. Took it out, put in dental implants, and he was good to go. But in a 13-year-old, it will save a tooth and save a space and save the bone in the area. Because if the tooth is lost now, the bone goes away if there's no implant. Well, he can't get an implant yet. It's not done growing. So save the tooth, watch the symptoms. Can mercury fillings contribute to a neurogenic cough? Mercury fillings contribute to everything neurologic because it's a neurologic toxin. So is it contributing? Very possibly. Can I tell you for sure? No, but very possibly it's contributing to anything that is neurologic or neurologically based. It's going to make it not work as well. So very possibly. Do I need to be put to sleep if I want the root canals removed, or is local numbing enough? So in our office, well, in some offices, they say it's removing a body part. Get be put to sleep for that. In our office, typically we'll remove one without any sort of anesthesia with just local numbing. But anytime it's more than that, it's just the procedure it's traumatic on the body. Even if you're numb and you're not feeling anything, you're hearing it, you're feeling it. It's traumatic on the body. And what we find is that you heal slower because the body's had to use up all of its basically stress hormones to deal with just laying there in the chair listening to all of this instead of using all those hormones to heal. So we find that you heal slower. So we recommend if it's just one tooth, sometimes we'll do it without, but if it's anything more than that, we do IV sedation, which is nice. It's not the same as, general anesthesia like you do on surgery at the hospital. It's IV sedation. And it's awake and asleep. It's kind of like a colonoscopy. Really recommend it. We find you heal faster and better. I developed one dry socket after removing a dental cavitation. How should a dry socket be treated to prevent another cavitation? I think we did talk about that a little earlier, but basically have it cleaned out, ozone, and more PRF in there. Is there a way to regrow receding gums? The answer is no. You're not going to regrow gums. However, you can stop the recession by finding out what's causing it. Is it the way the teeth fit together? Is it you can't breathe well enough so your tongue comes forward and pushes the teeth out? Is it that the gum is just really, really thin on that side and maybe you have gum tissue, which is shrinking away? So you have to find out the reason for the recession first, stop the recession, stop the reason. Then to regrow, you can't ever regrow, but we can reattach by grafting in the area. But it's key to find out the reason because if you just graft, what's going to stop the graft from receding if you haven't corrected the reason that the gum receded to begin with? Think about these things. A wisdom tooth was removed. What pain going on in the tooth next to it? That's frustrating. If your wisdom tooth is removed and you have pain next to it. So sometimes they'll have kind of bumped the tooth next to it. So I'd say have it checked. Make sure that tooth's doing okay over there. But also tooth powder, sensitive tooth powder, and mouthwash. Both of those will just bathe it in hydroxyapatite and may take away that pain. Extreme tooth sensitivity, tooth loss after braces. Too bad. Yes, actually options 100%. You need to do the sensitivity tooth powder and the mouthwash daily. Make sure you're doing that. And then I would also do the remineralization kit, which is minerals as well as vitamin D3 and K2. Check it out on livingwellwithdrmichelle.com. You can see it all on there. And you're just needing to rebuild minerals majorly if you've got some enamel loss there. I have a bubble on my gum. No pain. Any recommendations? It's next to a tooth that has a cap currently. If you have a bubble on your gum, you have an infection. It's either a gum infection or it's a tooth infection. So you've got to go get a cone beam CT scan and figure out what is that from. If it's gum infection, treat the gum infection. If it's tooth infection, it's root canal or removal. And I always prefer the removal and the replacement. So you need to look at it. I'm in France. What's the waiting time to come and see you? Well, that's a great question. You call and you get on the wait list, which is a long one. It's extremely long currently, but we then have sometimes shorter notice. I know from France, it's a little far away, but we can call you, a week out and say, hey, is there any way you could get here a couple of weeks out if we get something changed? Sometimes we get some schedule changes as well. And some of my other doctors have not nearly the long wait that I do. And I've been training them personally. In fact, one of my doctors, her name is Dr. McInerney. She is absolutely fabulous. And she has been following me, literally shadowing me every single one of my new patient days for the last couple of months. She's just started doing new patient days on her own. And she's like a mini me. She knows so much. She's incredible. So we have other options here in our office as well that are amazing that you don't have to wait as long for. My spouse had a root canal. What do you recommend that he looks for when going to a holistic dentist? So he needs to get a cone beam CT scan, and then they look at the end of the tooth to see, is there any new infection there? Root canal for a 13-year-old, number 19, extraction. Is there a way to save it? He also has cavities. So does my daughter. So we just answered this actually. So yes, on a 13-year-old, you're going to do a root canal on that tooth. And then you're going to watch it with x-rays and watch the symptoms. Cavities, remineralization kit, tooth powder, mouthwash. Same story over and over again, and check their gut. That's what you need to figure out on these kiddos. What is the stem cell recommendation utilized for tooth extraction? So what we use is we actually draw blood, and we have a special centrifuge that we centrifuge out the stem cells, the growth factors, and we put it back in when a tooth is removed. So it's called PRF. That's what you're going to want to look for is PRF. Platelet-rich fibrin is what that stands for. Do you have any colleagues in Orange County, California? So go on our website, livingwellwithdrmichelle.com. There's a directory on there where you can find a dentist. So go look. There we go. We got the website right up there. How to fix small cavities. So if it's very small, just in the enamel, the tooth powder works. So use the tooth powder every single day. And then what I tell people too, not only should you brush with this, but after you're done brushing, rinsing with mouthwash, you're going to use just a little bit of this powder and make a paste and rub it right on the spot that has the cavity. Let's see if we can't regrow it. Also the remineralization kit, minerals and vitamin D. You can hear that this is the same thing over and over again. Do any of your gut products help with gastric ulcers? H. pylori negative. Absolutely. You want Gut Well. And I would use Gut Well for probably 3 months. So what Gut Well is going to do is rebuild that stomach lining. So absolutely use Gut Well for that. Best recommendations for tooth replacement is a ceramic dental implant. Ceramic or zirconia is another name for it. So check that out. Do we recommend permanent retainers? I actually don't, because if your teeth need retention, they have not been left in a stable spot. Think about that. If they're stable, they shouldn't need retention, right? So that means that the tongue, the lips, the something don't like where they're at and they're going to move it. Well, then they're not in the right spot. So we need to get them in the right spot to begin with. I had a CBCT and a panoramic x-ray and the dentist said there was nothing wrong. I felt something was wrong. A month later, the tooth was dead and I'm told I need a root canal. How is this not seen? It's not always seen. An x-ray actually shows us something that happened about 6 months ago, interestingly enough. So it's not always seen on an x-ray. It has to have gotten that infection to really identify it. So that's too bad. I'm sorry to hear that. But at the moment, you can do a root canal or you can remove it and replace it with a zirconia implant also. Tori is getting larger, especially on the top palate. On 30-year-olds, should we treat, monitor, or not worry? So what is tori? Tori is extra bumps of bone. Sometimes you'll get them up here. A lot of times you'll get them down here underneath the tongue. They are signs that you are squeezing and clenching the teeth, especially if they're growing. So this is a sign that you have airway issues. Cone beam CT scan, sleep study. Figure out what's going on. And most likely you need to expand your mouth and make more room for your tongue and air so that you can breathe better. Can you say the list again for kids' health for teeth and gut? Yes. Do the baking soda test. Go online, livingwellwithdrmichelle.com, baking soda test, or all the socials. Go check it out. Baking soda test and see what's going on. So that's gut function first. There's a whole line of gut supplements there as well. You can see that all on the website. In fact, if you go to the website, you can take like a gut health quiz, whole bunch of things you can do. So figure that out. Tooth powder, mouthwash, both are safe for kiddos. So there's the citrus flavor of the tooth powder. Kids love it. I mean, they can use the mint too. It's the same thing. Everybody wonders, well, is it kid specific? No, it's the same powder. It just is citrus flavor versus mint flavor. They can use whatever flavor they want. And then the mouthwash comes in 2 flavors as well for the same reason. Citrus flavor, mint flavor. Sometimes the kiddos don't like the strong mint. So tooth powder, mouthwash, remineralization supplements. Online, you'll find liquid vitamin D and K. And then the liquid mineral, if the kid needs a liquid mineral, is that Mother Earth Labs, humic and fulvic acid. Fascinating or fabulous liquid. I'm still trying to make my own. We'll get my own eventually. All right. I have just a couple more minutes. Let's see if we can get a few questions back over here. Okay. Could your blood type be a reason your teeth have problems, and how to keep teeth properly and mineralized despite having a filling? Could your blood type be a reason your teeth have problems? You know, I've heard of this before. I've heard of this as a possibility. However, my answer is always, let's just look at the gut and let's look at minerals. You just need enough of them. And I think no matter your blood type, you're going to be able to have healthy teeth. Just fill them with minerals from the outside and from the inside. Just take care of it that way. I'm 76 years old. I have one tooth with a silver filling and another that has a crown and a root canal. Not sure what's made of, but the inside is silver. What do you recommend? Recommend a cone beam CT scan. Go check that out and see if the root canal's still healthy. The silver filling, get that removed. Find a dentist that will do what's called SMART removal. Safe mercury amalgam removal technique is what that stands for. Make sure you get somebody who's SMART trained. Look on our directory or look on the IAOMT.org directory. That's all the SMART dentists. So IAOMT, SMART trained. I just came across your YouTube. I recently purchased your powder and toothpaste, copper tongue scraper, and floss. I had a question. Okay, but I don't, back here. I'm getting cavities. I can see one in the front that's been around for some time. Does this toothpaste heal cavities? If so, how do I get the best results? And how do I know it's working? So same answer. What you're going to do if you see a spot for sure is you're going to brush, rinse. So if you rinse with a mouthwash after brushing with the tooth powder, it's okay to rinse right after because it also has hydroxyapatite. So you're going to brush with the tooth powder, rinse with a mouthwash. Then you're going to take some more of the tooth powder, make a paste with some water, rub it right onto the spot, and go to bed. That's the last thing you're going to do before you go to bed. Having flossed and tongue scraped everything first, but then rub a little bit of paste right on that spot and go to bed. How do you know if it's helping? Well, you're going to notice that the tooth structure kind of changes colors a little, and it gets really hard. It becomes kind of, if it's dark, it would be almost becomes a little like orangey colored. If it's just starting to get a little white, it'll become a little less white. So you're going to notice a color change, but it will become very hard and not soft, not squishy. So that's how you look for it. Is there anything that can naturally cure a cavity? Right here, basically what we just talked about. What is ozone? Ozone is 3 molecules of oxygen. So oxygen likes to be in 2s, but we use it in 3s because that third molecule of oxygen then goes and binds to bugs. Kills all of them. Kills bacteria, virus, parasite, fungus. It doesn't matter what it is. Kills them all. So we use ozone in gas form and water form and all sorts of different ways to kill bugs in the mouth, underneath old fillings, inside infected, where you had infected teeth and the jawbone. We use ozone everywhere to kill the bugs. So it's amazing. You can also get ozone at home that you can use for prevention, but ozone you have to be very careful with because it damages lungs and eyes. So we're very, very careful of that in the office. One up here. I removed first bottom molar 2 weeks ago. How long will it take for the gum to heal? I'm scared food will get stuck. It takes a little while for the gum to heal. It's about 3 months before it really covers over and fills in completely. So it'll be a bit. Just make sure you're very carefully cleaning that spot so stuff doesn't get stuck. Over my head. I'm new to teeth problems, and unfortunately, I don't know where to start with these problems. I know it's a lot. Go on the website, go on the YouTube, go everywhere, and you'll be able to hear these words again and learn a lot more. I started taking Fulvic and D3 and K before I found you. Awesome. Those are great. Is there help for a tooth with a deep cavity? I will do no more root canals, and my dentist refused to remove it. Well, first of all, it's your tooth, so you can remove it anytime you want because you can choose to do that. It's your tooth. Just yesterday, the patient told me that exact thing. She's like, I just want it out. I said, great, let's take it out then. She's like, seriously? You're just going to do what I said? I'm like, that's my job. I'm supposed to do what you asked me to do. It's your mouth, right? So yes, it's your mouth. You can get it out. But if there's a deep cavity, you can use ozone and a filling or an onlay or a crown. So look for somebody who does holistic dentistry. Look on our website, look on the IAOMT site, and you'll find somebody. I'm noticing pain in a tooth about a half hour after I brush with the powder. I've ordered the sensitive powder and waiting for it, just in case it's the mint at first. Yes, make sure it's not the mint, but it might be that you have a cavity in that tooth that may need to be addressed because it might be that it's deeper than the tooth powder actually can get to. So wait and see, but if not, go have a dentist look at it. What do I use for a soil amendment to give my vegetables minerals? I use compost. So I use compost, and in my compost, I add a lot of comfrey, comfrey is a miner. So it has really deep roots and it mines way down deep in the soil and brings the minerals up into its leaves. If you don't have that possible, use compost. So go find some good bagged compost that has a high mineral content. Oftentimes, if you're getting bagged, you're going to be able to see the mineral content there on the bag. For the past 2 months, I have yellow mucus, excess runny nose, as well as coughing and wheezing in the morning. I feel like coughing up all the mucus that went down my throat through the night. That is really miserable. A lot of times we will see this happen if you have a failed root canal somewhere that's draining into your sinuses and it's filling your sinuses all night long with gunk. So go get a cone beam CT scan. Most likely you're going to find something. Doctor said I have asthma. I don't feel like I do. I had a patient yesterday that said the exact thing. Started having major issues about 2019, was diagnosed with asthma a couple years later. And this is not a young woman. She's probably in her at least 50s or 60s. So she's like, why haven't I had asthma up till now? Well, it wasn't that. It was, we think in 2019, an infected root canal broke through the sinus and started dumping everything into the sinus. She's had horrible sinus congestion and lung issues since then. Tooth's coming out ASAP. Not just kiddos, exactly right. Some people don't like mint either, so that's why we have the citrus flavor. Is twice a year x-rays actually safe for kids? I don't like to do twice a year unless they are cavity prone. So if your kid got cavities in the last 6 months, we're going to do x-rays again because we want to catch them while they're small. But if they have not had a cavity in 6 months and a year and a half, we're going to go to every year and a half even for x-rays. So we just use them if needed, but you do need them. About every year and a half is really typical, about minimum time frame, every year and a half to 2 years, but they don't need to be every 6 months if they're not getting cavities. I'm 30 and I brushed my teeth and bought your powder a couple hours, but I have lots of fillings from my past and I got a root canal about a year ago. I'm waking up with migraines and my teeth ache sometimes. I do my cleanings. I tell them no fluoride. So yes, tooth powder, mouthwash. and remineralization supplements. It's going to really help. Okay, you guys are doing so great. Thank you so much for the questions, everything. You're awesome. I got to jump off myself here now, but I just love that you're coming on here, that you're asking questions, that you're wanting to find out answers, and that you continue to look. Get on the website, check out things there. We have all sorts of free guides and free information. Get on YouTube. I'm starting to do really long videos. I mean, not like, hours long, like 10 minutes long, because I need to deep dive into some of these topics. So if you really need a little deeper dive, if these words are going over your head, jump on YouTube, because I have longer explanations on there where I don't have to talk so fast, where I can go slower and really just get you what you need. So go check it out. Love that you're doing all this. Keep coming back. We'll be here every week, except for next week. But we'll be here most every week. We'll let you know when we're here. Thank you all. Have a great day.